Hello everyone, I'm Dr. Sumina Reddy, fertility consultant and laparoscopic surgeon at Fertilica IVF, Hyderabad. We all know the importance of diet in our regular life as well as in reproduction and fertility. మనం తినే ఆహారమే అమృతం కావచ్చు, సరిగ్గా తినకపోతే అదే ఆహారం విషం కూడా కావచ్చు. So today in our video we'll talk everything about diet and how it influences fertility and reproductive health. To discuss the nitty-gritties of diet with us, we have Ms. Soumya, who is an accredited dietitian and nutritionist who completed her master's in dietetics from Monash University, Australia. Welcome, Soumya.
Thank you for having me.
So, please let us know what is the actual connection between the diet and reproductive health.
Right. So let's talk about female fertility first, right?
Yeah.
So diet in fertility is it's huge, like it's multifactorial how diet affects fertility. There are micronutrients that help improve fertility. There are certain lifestyle dietary habits that ruin fertility as well.
Okay.
So when we're talking about lifestyle, we're talking about BMI predominantly. So if a person is obese or lean, that being said, if someone has a BMI of over 25 or under 18.5, that can adversely affect their fertility. If their micronutrient stores such as folic acid, iron, vitamin D, vitamin B12, magnesium as well, and CoQ, so a lot of antioxidants, if the intake of that is less as well, again that could adversely affect fertility. Now fertility, when we look at female fertility, there are two predominant things that we look at. One is the uterus or the endometrium health, and the other one is the egg quality. Yeah, correct. Yeah. So usually when it comes to endometrium thickness, diet is pretty straightforward. There are a lot of dietary changes, additions of certain food groups that could improve endometrium thickness. When it comes to ovarian health, again, we can't do anything about egg quantity, unfortunately.
Age plays a very big factor in the ovarian quality and the egg quality that we get.
Exactly. I would say that's like the first, the predominant factor that defines the course of treatment next. And then obviously micronutrients and all of that play an important role in improving the egg quality. However, if there are certain health issues, you would know better. Yeah. If the tubes are blocked, or if women only have one ovary, if they are obese, then that would affect their endometrium thickness. So everything's interlinked in terms of how diet influences fertility.
Very true. So are there any specific nutrients or micronutrients that are important for women who are looking out for fertility or to improve their fertility?
Yeah. So I would be biased and I would say everything.
Of course.
But to be very honest, I would say vitamin D is the first thing that I would ask someone to make sure the levels are high of. So research says that if you have a higher level, more than 50 of vitamin D, when you do your blood test, that would lead to an accurate AMH test. Anything below that could hinder with your AMH results as well.
Okay.
Plus vitamin D consumption is obviously linked to improved success rate of maternal and fetal outcome. The second most important thing is omega-3. I cannot emphasize enough how much omega-3 is important for hormonal regulation, for you're getting your periods on time, for inflammation, every single thing. Omega-3 is something that I would give extra of women who are over the age of 32 to. The other important thing is antioxidants, especially CoQ10. That CoQ10 is a potent antioxidant that helps improving egg quality. Zinc is another super important nutrient. I think I've seen you prescribe zinc for a lot of women as well, because that again regulates periods, it regulates your egg health as well. Probiotics and prebiotics. True. Not a lot of people emphasize on the importance of it. Yeah, and the reason being, there is a link in between your gut and your hormonal axis. So to make sure your gut is healthy, you have a lot of good bacteria in it, that's something I put out there.
Correct.
Yeah.
So to summarize it, the important micronutrients are vitamin D, omega-3 fatty acids, CoQ, probiotics, zinc, And of course, folic acid. We cannot
Absolutely.
folic acid for women in reproductive age.
Correct.
So, what are the important food sources where we can find all these micronutrients?
Okay, so let's start with folic acid since you brought that up. So folic acid is an unsaid rule that every woman, no matter what, needs to take 3 months before they try to conceive. So folic acid, easiest way to get it in obviously are supplements, but when we're looking at food,
Natural food sources.
it's a lot of green leafy vegetables. So a lot of spinach, a lot of methi, totakura as we call it in Telugu. So a lot of green leafy vegetables are predominantly the source of folic acid. When we talk about zinc, zinc is something that's found a lot in seafood. So a lot of shellfish. For vegetarians, I do ask them to have at least 1 to 2 cups of dals in a day, because zinc's again found over there as well. What else? Omega-3. So omega-3, again, it's predominantly your nuts, your seeds, fatty fish. As a rule of thumb, I ask people to have 4 walnuts in a day, because 4 walnuts have the amount of omega-3 that you need in one day. And anything other than that, whether it be supplements or through other sources, is just a bonus.
Okay. So don't forget your leafy greens, seafood if you can eat them, nuts, especially walnuts, and of course include a lot of dals in your food.
Correct.
Isn't it?
Yes.
Okay.